In this video, I'm going to talk about positions to maximize function that you can leave your patients in after a treatment session. So the first one we're going to start with is seated position. If a patient lacks, if they're in a slump posture, then you can create a towel roll and stick it behind their lumbar spine. So if you're leaning forward for me, Miss Jacobs. And then have them sit back. This really opens up the chest and creates a better posture for them. And you may need to bring it up just a little so they can sit more upright. The second one I was going to talk about is if they have difficulty weight shifting to one side or the other. So let's say that Miss Jacobs does not want to weight shift to her right side. So I would put a towel roll or a wedge or whatever you have under her wheelchair cushion so that she has to weight shift to the right. So I would do this while she was out of her chair. But you can go ahead and stand up for me. So while the patient was out of her chair, I would wedge it, and then when she sat down in the chair, then she would be forced to weight shift towards the right.
Functional positioning in the supine. Most patients, when you come into the hospital room, this is exactly how you see them. So they have external rotation of the foot, pillows under knees, 2 pillows under the head, and this is exactly what we do not want. So in this position, we would take 1 pillow from up under our patient's head and educate them on why they don't need to carry over to gait because of a bad posture. And then we would get the other pillow from up under the knees because we need to let go. So as you see here, she's already straight. This is carry over to gait. We need knees extended and we need the hips to be more extended than flex. And also, you see she's externally rotated. Have the multipodus boot, which is going to put our patient in a neutral ankle. And with a kickstand, it's going to actually cause her not to be able to external rotate. Just like this. And also, as far as the bed, we're going to put the bed down. So encourage our patients when they're watching TV to try their best and not to be more level. Not exactly flat, but not too much flex. And there we go. Third position on functional positioning, and this is actually prone. So we're going to encourage our patients to lay like this. It's also known as tummy time, at least 30 minutes a day to 2 hours a day, as long as they can take it. It's a really good position for your patient to watch TV in. They can actually do activities right here, do some reading, just making sure this is helping with head control, also stretching out our hip flexors and with our back extensors. And if your patient's not really good with head control, you can make sure your patients can lay this way, the head looking this way, or the opposite way. Or we can also use the cervical pillow is a good option too. But this is a really good position for our patients. And we're going to encourage them to stay this way for as long as they can.
In this video, we're going to talk about functional positioning and standing. So here we have Chastity on the tilt table. She has a difficulty in weight shifting to her left side. So I have her tied in with the straps here. We have 3 straps on. She has trunk control, so I didn't put one around her chest area, but she has one around her waist. And also you can see there's a towel behind her bottom. This is to keep her in straight alignment on the tilt table. And so then there's one around her knee to keep her knee from buckling. And then lastly, the one around her foot. This is to keep her leg in a little bit of adduction, because in mid stance your foot is in adduction and not abduction. Here we have Chastity on the tilt table, and we placed a towel under her metatarsals, and this will help work on dorsiflexion. You can do it under both feet. And then also thing you could work on here, take this from you. So if you loosen the straps a little bit, if she has some weakness in her quads, you could work on mini squats in this position, and she would be safe. If she buckled, the strap would be there to catch her.